It is the 8th day of the 10-day lockdown in Kigali and 8 other districts across the country. Authorities, including security agencies and volunteers, are continuing to monitor compliance with safety regulations. There's a general belief that the country is at a critical time in regards to the fight against the surging number of COVID-19 pandemic.
In Kabeza, there is a young man I know who is sick, and another one in Rubavu. I think there are few families without COVID-19 patients in this country. People should stay home and be cautious because the new variant is even killing young people. We see reports of more than 900 new infections a day and 800 recoveries, but still the infection rate is higher than the recovery rate. Although the level of compliance with COVID-19 prevention guidelines is generally high across the country, including hand washing, physical distancing and imposing lockdowns in COVID-19 hotspots, some areas of Kigali city have not complied with this, and people find it unreasonable to make unnecessary movements in the neighborhood, seeming unbothered by the reason for the ongoing lockdown. Some residents say such behavior put the lives of the community at risk.
Spreading,
and we may stay under lockdown. What I would recommend to people is that they follow the health guidelines and stay indoors.
At the end, we will all get sick, and some will die if we don't follow the health guidelines. What I would recommend to people is to follow the prevention guidelines. Wear face masks properly, practice physical distancing, wash hands, and avoid unnecessary movements. Everyone has to change their mindset if we are to survive this pandemic.
The Minister of Local Government, Jean-Marie Vianney-Gatabazi, says the ongoing third wave of COVID-19 is of concern, adding that no one should disregard the precautions.
Our campaign is aimed at making the public understand that what we are asking for is in their best interest. COVID-19 has taken a lot of time and people seem to be tired, even though they have already realized that it is a serious problem. We may have 2 days of lockdown remaining. There are those who say we will extend it. The increasing infection rates are frightening to them, while previously they considered it just like any other normal disease. Now that the virus has reached almost every home, some have lost their loved ones, while others have seen people get critically ill and be hospitalized, others die. They should stop waiting for the time it will get to them, but rather respect the guidelines.
Dr. Saben Sanzimana, the Director General of Rwanda Biomedical Center, explains that the new COVID-19 mutation, known as Delta, is behind the increasing infections and deaths in the country.
The numbers have skyrocketed to the point where we lose 10 people and more a day, which means that the number of critically ill people has increased. It is not that people have played a role in the increasing number of new infections, but rather it's about the virus that has changed severely. We have Delta and is the most prevalent type of COVID-19 virus here in Rwanda and across the world at a rate of about 80%. It is behind the increasing new infections and deaths because it makes the body weaker and it rapidly destroys the lungs.
As of Friday, 24th July 2021, the COVID-19 infection rate in Rwanda stood at 5.6%. The Health Ministry says the pandemic, which has already killed more than 700 people, has spread to all sectors of the country, urging people to be more cautious. Reporting for RwandaTV News, Ethan Tashobia.